Okay, so what's going to happen is Miriam's going to put everybody's cough and cold medicine video together. And if you're saying something, not that anybody said anything grossly outrageous, but just things that I wouldn't 100% agree with, like I'm going to like caption it at the bottom. Because, if I put this on my YouTube, I don't want to give away like information that isn't what I 100% agree with. Like, okay, so Samira's video is the only one that I got with enough notice to watch it before this meeting. And it's not like there's anything in it that I disagree with. But Samira, I think that you said that you would not recommend taking Sudafed with an antidepressant, which is actually fine. And I'm sure that there's even medical professionals that would not recommend taking Sudafed with an antidepressant. However, me having done this for however many, many, many years, it doesn't strike me as anything that's terribly contraindicated. And contraindicated is the word that doctors use to describe two things that can't be taken together or would be like bad. So I wouldn't straight up say that Sudafed is contraindicated with an antidepressant, even though probably if you look it up on the internet or something, it would say that. But I've never in my life encountered a problem. Actually, even with the things that are absolutely contraindicated, which is dextromethorphan, I've still never seen a problem with anybody take it with a cough with antidepressant. So that's what I mean. Like if I write something underneath, it's not like you guys said anything terribly wrong. It's just like I have things to add given like my years of experience. Um, like based on what I saw, like like you're definitely not supposed to take dextromethorphan with antidepressants because they're not really sure how dextromethorphan works. It's like in Robitussin, and you guys have probably not heard this, but in the olden times there used to be this phrase called robo tripping, and that's because people would like get high and hallucinate on Robitussin. They're not really sure exactly how it works, but they think that it actually, instead of doing things like um, constricting the blood vessels in your nose or working in a systemic way throughout your body to combat cough and cold symptoms, it actually somehow works in your brain. And if you take a lot of it, you're going to start hallucinating. So it's like more of a brain medication. And so you're actually, if a patient of mine asks like what can I not take, I would probably actually say dextromethorphan, even though I have known probably hundreds of people who have taken antidepressant and dextromethorphan and never had a problem. But I would say that that's probably the biggest one out of all the meds that you guys were assigned to not take. So with, I guess there's different levels of contraindication. So there's like, maybe something bad will happen. I guess there's, if you think about it, like a high likelihood of something bad happening, but the thing that's bad happening isn't really like a big deal. So like with the Sudafed, with taking it with an SSRI can cause like blood pressure issues. And so these reactions, like to the two medications together that you're talking about, are for healthy people. It completely like changes the ball game if we're talking about taking antidepressant and cold medicine for somebody that has like health conditions or like heart failure and stuff like that. So when we are talking very general and basic for uh, for this lecture, I'm just talking about healthy people. So like, yeah, maybe let's see, like Sudafed. Well, actually, let's talk about what these things are, because when we say a name brand, one of the confusing features is like it can have three different things in it. So the big thing that I wanted to just point out is that the biggest contraindication is going to be the dextromethorphan with the antidepressant. I would recommend against that. However, I've never seen anything bad happen. Um, Okay, so the other things that I wanted to talk, I said about robo tripping. You take enough of that, and it affects your brain certainly, and then you hallucinate. So a big thing before we get into that, I definitely want to make a point of is that phenylephrine doesn't work, and that is actually something that is just come out to be more mainstream, this knowledge, is that it's been around for a long time. And I think that scientists or companies have known that it's not really effective, but they haven't removed it because it's also not harming anybody either. But I think that they're probably gonna start taking it off the shelves because it doesn't do much. Now, what actually does something is pseudoephedrine, and that definitely does help people reduce their nasal congestion. But the reason that people don't gravitate towards that as much is that is located behind the counter and you have to give your ID. Does anybody know why you can't just walk up and buy it off the shelf? Why you have to go to the pharmacist and give your ID? Does anybody know why? Does anybody watch Breaking Bad? Doreen.
Would it be to prevent like situations in which like people overdose, perhaps?
Well, that's a good thought, but it's because people can make meth out of it. Um, so it's good that you guys haven't watched Breaking Bad.
I
It's
watched it. It's a
uh,
really good show.
oh, okay. All right. I was like, you guys are just so young and innocent. And you'd never watched. But yeah, like if you can actually make meth out of it. And so then people got really scared and it got like pretty restricted. And so even though it is the one that works, it's hard to get and people are scared. But it don't just get something that doesn't work because it's easier to get. But anyway, so another point, and I'm going to let you guys talk about each of the medicines that you're assigned to, specifically what the components of it are. But before that, I want to make a few more points. So for Mucinex, you want to make sure that you have a lot of water with that because it's not going to work if you don't have enough water. And then if possible, you could just buy a generic that what is in it is the only thing in it. Because when you're taking these like name brand cough cold medications and then there's like four like generic medications in it, you might be taking something that you actually don't need. So if possible, just buy the um like independent ingredients like one by one. So you want to get brands that don't have like a ton of ingredients and random weirdness in it. And so none of these cough and cold medications are actually doing anything to get rid of the viruses because there's 200 viruses that cause colds. And so you can't you can't really focus in on like what it is. And usually they do go away. And then the last thing I'm going to say before I let you guys talk is that while some of these medications that we're going to talk about are fine in adults, not only do they not work in young children, but they can cause a lot of problems. Like Benadryl, I have seen kids in like the psych ward after taking Benadryl because they're absolutely just like hallucinating out of their minds. Like, so I wouldn't give any of this stuff to kids under 6. If you have a kid, a little kid with a cough and a cold, then I would suggest saline flushes, lots of water, using one of those sucky bulbs, and then honey, but not honey for kids under 1 because then you could get botulism. So there's really just like a lot to take in there. So if people are watching this video, they may have to rewind a little bit. But the main points is that it has become more known that phenylephrine doesn't work. Pseudoephedrine does work, but please don't make meth with it. You have to give your ID to the pharmacist to get it. If you take Mucinex, you want to take it with water. If you go and buy cough and cold medications, try to buy the ones with the least amount of ingredients so you're not taking like all this like random extra stuff you don't need. And then while some of these things can cause issues with psychiatric medications, the biggest one is SSRIs and dextromethorphan. But again, you would want to ask your doctor before taking any of this stuff if you're on a prescription. And the caveat is this is only applicable to people that are not sick with other things on top of it. And so I guess that's just the rundown of like the main points about this topic of cough and cold medications that I wanted to convey to you guys. So now you can take over and I want to hear one by one you guys talk about your specific medication that you were assigned, and then in particular, like what are the components of it? Because you may have something that only has like one ingredient, and then you may have been assigned something that has four, and then that makes your discussion a little bit more complex. So let's do Doreen. She got Benadryl, and I wanted to specifically know, like, can you use it for colds or just use it for allergies? So Doreen, can you tell us about Benadryl?
Yeah, so I addressed like the drug Benadryl in my video, and Benadryl can actually be used to treat both cold and allergy symptoms. And they can be like, for example, like, but not limited to hives, watery eyes, and itching, or like runny nose. And the components of the medication include hydramine hydrochloride, which is the active ingredient. And then like it exists in different strengths. And some contraindications include nursing mothers, as well as individuals who have like sensitivity to diphenhydramine hydrochloride. And then if taken with antidepressants, Benadryl can lead to side effects such as drowsiness.
Right, that's true. So that's definitely like all true. However, again, me with my experience and advanced training, I actually wouldn't be too upset about a nursing mother taking Benadryl. I, in fact, was a nursing mother taking Benadryl. I was a pregnant person taking Benadryl. You have to weigh the pros and cons and risks and benefits, and there isn't any research that says like Benadryl does this like real crazy thing to you. But yeah, it can make you sleepy. And that's actually where I was taking it, because it was like literally impossible to sleep. So yes, if you are like, even if you're a doctor of a different specialty, you might say like, yeah, don't take this while breastfeeding. But I just have a little bit more experience, so I actually would not recommend. But anybody watching this video, I can't, because like I said, this isn't applicable to people that have other illnesses going on. It might not be applicable to people on other medications. So my medical advice is only medical advice if it is given to somebody during their actual appointment with me. So don't sit and say like, oh, Dr. Waggel said that I could take this while breastfeeding. No, not unless I told you it during an appointment. But you're correct, Doreen. Everything you said is right. And I would just maybe change things based on my experience, and of course customized to the patient themselves, but in general, exactly correct. So Aditi, Mucinex, Mucinex DM, etc. So how many Mucinexes or Mucini are there, and what is in them?
So, do you mean like different versions, like Mucinex Sinus, Mucinex Coffin?
Yeah,
Okay.
it's confusing because if somebody's like, oh,
Yeah.
take Mucinex, and you're like, which one?
Yeah,
So
there's
like,
a
what are
lot.
the differences?
So I know there was Mucinex Sinus, Mucinex Cough and Chest Congestion, Mucinex Multi-Symptom, and Children's Mucinex. So all of them have the main ingredient, which is guaifenesin, if I remember correctly, and like
Mm-hmm.
that helps like loosen and thin the mucus in the airways, and so it's easier to cough up. And Mucinex also has like 8 different active ingredients, like in general, which also includes dextromethorphan, which you mentioned.
So whoa, that's a lot. So which Mucinex has 8 ingredients? I didn't even know that.
Yeah,
That's
it has 8 active ingredients.
so. Wait, can you name them? I know that's a lot. Gee,
Okay.
I may never take Mucinex again because I'm all about like just like one ingredient at a time. So what are the 8?
Okay. There's acetaminophen,
Okay,
which
that's
is
just Tylenol. So that's going to
yeah,
reduce fever. That in general doesn't have too many contraindications, but it's like
uh-huh.
liver problems and if you're an alcoholic. So there are some. So okay. Acetaminophen, keep going.
Dextromethorphan, which is the cough suppressant.
Which you'll be
Um,
road tripping. It interacts with the brain. Okay, yes, it is a cough suppressant. It does actually work. Well, there's some research saying it does.
yeah.
Continue.
Guaifenesin and expectorant.
Yeah, so the guanfacine, which is how I pronounce it. I've heard it
Oh,
pronounced.
I don't know.
No, I've heard it pronounced a lot of different ways, and I'm not really picky about how you say it. But that is what I think of when I think of Mucinex, and it's an expectorant. And yes, so yeah, that when I think of Mucinex, I think of that one, but keep going because there's all these other things, and that's just
Yeah.
what are.
Phenylephrine,
Okay,
HCI.
so that's the phenylephrine, and if you remember, I said that
Yeah, you
doesn't.
said it doesn't work as well.
Hmm.
But that's a nasal decongestant, right?
Allegedly.
Okay. There's triprolidine, which is an antihistamine, and
Which
then
is similar to Doreen's Benadryl, diphenhydramine. That's
mhm.
histamine too. Okay, keep going. This is interesting. There's a lot of stuff to unpack in this Mucinex. Holy moly, keep going.
um oxymetazoline hydrochloride. I'm not sure if I'm saying that right.
What is it?
Oxymetazoline?
Ozzy. Oh yeah.
Oh,
Oh,
oxy. I don't know.
uh-huh. Yeah.
And then that's also another like nasal decongestant. And
Mm-hmm,
then finally there's doxylamine succinate,
mm-hmm.
which is another antihistamine.
There's a lot of
Yeah.
antihistamines in here that I didn't know they had so many, and that's why you gotta break up. That's why you gotta break these things apart. Very interesting.
Mhm.
All right. Anything
So
more about wow, Mucinex? I mean, I'm sure there's plenty about Mucinex considering
yeah.
it has 8 different ingredients in it.
Uh-huh.
Holy moly.
So
Um,
obviously there was going to be a lot of contraindications because of
yeah,
like all of the ingredients.
the math, the statistics.
Yeah. So Mucinex cannot be used for children aged less than 12 years old. Um, and it can't be suitable for people like with cough from asthma, bronchitis, or like emphysema. And
Okay.
then also people who have like excess amounts of phlegm. And then you mentioned this earlier, but like I don't know if Mucinex can be used with people who are breastfeeding or pregnant. Like as you said, you used the other medicine while you were. So
Benadryl.
Benadryl, right. So I mean,
That
when I
was the top.
researched, it said
I
to
don't know
cough.
off the top of my head because there's so many ingredients.
Yeah.
I would honestly just to be safe say like no, like try one of the other ones
Uh-huh.
because or just the one with the guanfacine um because that is typically pretty okay for pregnant people like just by itself. Like do you need 8 different things? Like if you need
No.
8 different
And I got
medications then
this
maybe
like
it's
all
not just the
from
cold. Hmm?
and I got this all from like mucinex.com. So like it was just straight off the website.
Okay. All right. Well, we hope that they're being truthful. All right.
And then
Wow.
as for antidepressants, you mentioned like because it has dextromethorphan, like it won't be as good to use it with it.
Yeah,
So
that would probably reach my threshold of where I say don't take it, don't take an antidepressant with dextromethorphan. Although I've literally seen lots of people do it and nothing happened, but I would still not think it's a great idea.
yeah. But like surprisingly, some people get like insomnia and like diarrhea
Yeah,
with
you
that.
oh yeah,
So
you can have especially if you're taking a med that has 8 meds in it, you don't know which of the ingredients is causing what. I just at the beginning before you were talking, one of my recommendations is just to take a medication that's the only medication in it. So wow, Mucinex. Wild. So much stuff. Who knew? Okay.
yeah, that's it.
Okay, that's enough, I think. All
Yeah.
right, very good, very good. And then Samira was gonna do
Sudafed.
Sudafed. So this is interesting because when I think of Sudafed, I think of pseudoephedrine, but I am surmising that like you go and you actually buy Sudafed, that there is other stuff in it. So Samira, tell us. There's probably different types of Sudafed. So Samira, tell us what is Sudafed? Are there different types? What's in it? Are there 8 separate ingredients as well?
So I recall reading about two different types of pseudoephedrine, which like are Sudafed. So there's like the one with pseudoephedrine
Mhm.
hydrochloride, and then also the one that contains phenylephrine in it.
My
And
enemy. I don't hate it. I'm just saying.
yeah.
So what does it do?
And
Did you
so it's used for
read
nasal
that
congestion.
phenylephrine doesn't work?
Hmm?
Did you read that phenylephrine doesn't work?
Actually, I remember on one site it said that phenylephrine is more effective but has more risks.
Interesting.
I'll look at that. I'll try to find that one website. Um,
Well, it's apparently a hot topic right now that people are getting mad that it was being sold for so long when people knew that it didn't have any data, but hot topic. Okay, so which
Interesting.
Sudafed contains phenylephrine and which Sudafed does not?
So it was called Sudafed PE, the one that contains phenylephrine. Yeah.
Yes, that makes sense.
And so it's just used for nasal congestion, meaning you can use it for like the common cold or allergies, or even hay fever, I believe it was.
Yes, which Dashita knows is rhinitis. Um, which and okay. So as I said earlier, it's not like any of these things are actually fighting the virus. It's just controlling the symptoms. And then I gave examples of how some of them work systemically in different ways, like particularly, in your nose. And then the dextromethorphan is believed to affect your brain. So with pseudoephedrine, do you know what that is doing? That the mechanism by which it actually helps you to not have such a runny nose?
I just remember that it like helps reduce the swelling in your nose.
Well, yeah, not necessarily the swelling in your nose, but the swelling of the blood vessels in your
In
nose.
your nose, yes.
The
Yes.
blood vessels. So yes, that is how that works. So that it's nice to know that at least some of these medications they do know how it is helping, but some of them they're like, oh, it does something to your brain, and then you're not so snotty. Um, so okay, Sudafed, I just equate to pseudoephedrine, but Sudafed PE also contains phenylephrine, which is the thing that they're finding out may not actually be doing anything. Any other Sudafeds that contain any other ingredients?
Those were the two that I looked into. I bet there may be a few other types.
I'm sure they make a morning one, an afternoon one, an evening, a tea time one for all different things. And then you did say that it does potentially cause problems if you take it with antidepressants and can change your blood pressure.
Yeah.
And that's true. Um, But would it be to the point where Dr. Waggel would tell people not to take it? I think I won't answer that question and I will only answer it for people on an individual basis. How about that? We'll just leave that one up
That's
there.
very valid. Yeah.
Okay. Riddy? Did Riddy say that she was going or something? Going. Dashita, Tylenol cold and flu versus Tylenol cold and flu and cough. Ooh, what's the difference there?
So Tylenol's main active ingredient is
I
acetaminophen.
want to put your video on because we're recording. I mean, if you don't want to be on video,
No, I
because I'm
had it.
recording it and it just looks like you're an anonymous.
No, I like turned it off when I went to get my charger. But the main active ingredient for like across all Tylenols is acetaminophen, which is a pain reliever and also a fever reducer. And the
Correct.
difference between the cold and flu one and the cold, flu, and cough one is, correct me if I mispronounce this, but it's dextromethorphan, which is a cough
It's
suppressant.
that's fair enough. It's dextromethorphan and or
Dextromethorphan.
dextromethorphan. Yeah,
Yeah. So that's a cough suppressant. And these medications essentially inhibit the production of certain chemicals in the brain that cause these pains and fevers. And some contraindications for Tylenol would be like um, allergies for like people who are allergic to acetaminophen. And
Mhm.
then also liver issues are really prominent.
Yeah.
And
Yeah. You
combining
don't want to take Tylenol if you have liver problems.
Yeah. And combining acetaminophen with alcohol is also known to be
Correct.
detrimental.
That's true too. And I think that I had mentioned that earlier as well.
Yeah.
So the reason I wanted to bring all this up is because I swear I had a day where I had 12 patients and 10 of them were sick with some kind of cough or cold. Thank goodness it was a telesession, but there's something going around and I've been getting just swarmed with Dr. Waggel, can I take this cold medicine with my psych medication? And I kind of know off the bat like which ones do what, but then it's complicated when you have things like Mucinex that have 8 things subcategorized. And then, like in your case, Dashitha, is the Tylenol cold and flu versus the Tylenol cough, cold, and flu. Because if I had a patient that was like, Dr. Waggel, can I take Tylenol cold and flu? I'd probably say yes. But what if they meant Tylenol cold and flu and cough, which has the dextromethorphan, in which case I would actually say no. So the most complicated thing about my job is whenever these overarching medications in fact have like medications within medications within medications. So that's why I've obviously like done my own research, but I thought that would be a good topic because it's pretty prevalent. But my general rule of thumb is I just like say no to dextromethorphan because like it does come into the brain. I'm telling you what, like you don't need all that extra stuff. So I would think that is, again, I have to make the disclaimer that this is not medical advice. It's completely dependent on the individual I'm talking to because they might have underlying medical conditions and they might be on other medications. But you could take Tylenol with an antidepressant. And then some of these medications actually have like ibuprofen. And I usually do say it's okay to take ibuprofen with your antidepressant. There is a theoretical risk of like bleeding issues. So I would ask somebody like, do you like if you get a paper cut, does it just like bleed for like an hour or like are you bruising easily? So those are some things to take into consideration. But overall, I would recommend the guanfacine, I think, is pretty good. And then the pseudoephedrine, but then that can increase your blood pressure and it's a stimulant. So if you're on, depends on the psych medication you're on, because if you're on a stimulant, you don't want to have multiple stimulants. So I think the general rule of thumb is that you would just have to specifically ask your doctor because there's like so many things to check. And then another big rule of thumb is like if you're on a psych med, just like don't take dextromethorphan. I'm not saying that something would happen to you, but I'm just saying with that, the chances are higher than like the other things we talked about. Does that make sense to everybody? Does everybody feel like they learned a lot today?
Yep, it was very informative. Yeah.
Good, good. I think the thing that I actually learned today is some of the versions of Mucinex have like a bazillion medications in them. So next time somebody is like, can I take Mucinex? I'm going to reply to them like, can you be very specific as to which Mucinex you are talking about? In fact, just send me a picture of the box. I think that's what I'm going to do. All right. So great job, you guys. I think everybody did really well. I will watch your videos. Well, actually, no. When I hang up, I'm going to go back, send more prescriptions in, and write notes. So no, I'm not going to watch your videos tonight. But just keep that in mind for next time. I don't think I said when to turn them in, but like maybe I did. I don't know. But like if you send them in like the day, like I'm probably not going to have a chance to watch them, but I will watch them at some point in the future. Probably on a Saturday morning at 5 a.m. before my children wake up. How about that? All right. Thank you, everybody. You all did a great job. I'm going to hang up now, and then Tree, I think, is going to send like a summary of everything that we talked about. And then this cold medicine video should be out once Miriam is